I'm Dr. Sri. I'm a board-certified family medicine and sports medicine doctor, practice in the United States, Kentucky. In this video, I'm going to provide the advice for general public on the minimum amount of strength training one has to do each week. I'll talk about the optimal number of sets and repetitions that one has to do, and also discuss about how to structure your workouts. So this information is targeted at absolute beginners and those who wish to ensure that they adhere to minimum standards for strength training. As a busy family medicine and sports medicine doctor, so during busy weeks, I can only often stick to the minimum recommendations. However, when I have more time, I may add an extra day to my strength training routine to go beyond my minimum threshold. By the end of this video, you should be able to create a comprehensive strength training workout plan for both gym as well as home environment. I also have good news. At the conclusion of this video, you will gain access to a complete follow-along home strength training program that does not require any equipment and is designed for absolute beginners. So without further ado, let's get started. The American College of Sports Medicine recommends individuals to do strength training 2 times per week, focusing on major muscle groups. However, this recommendation does not apply to bodybuilding or improving aesthetics. A bodybuilder or someone focused on aesthetic fitness must ensure balanced development across all muscles. You cannot afford to have a well-developed chest paired with underdeveloped biceps. Therefore, the bodybuilding workouts or aesthetic workouts are meticulously planned to avoid such imbalances. However, when it comes to general fitness, the emphasis lies on strengthening major muscle groups that are crucial for everyday activities. Consider the various pushing and pulling movements that you perform daily, or bending down to lift objects with a proper hip hinge. These essential movements require regular training to maintain strength. As we age, our muscle mass and strength naturally decline. Building our strength now ensures that we are better equipped to face the challenges of aging. So the best approach would be to do a full body training 2 times per week. So this way you can hit one major muscle group twice per week. But let us say if my patient wants to take their muscular fitness to the next level, in that case, one can consider 3 times per week. So they can hit one major muscle group 3 times per week. But let us say if one wants to do 4 times per week, in that case, I'll recommend doing upper body 2 times per week and lower body 2 times per week. But remember, the minimum recommendation is to do at least 2 times per week. How should you structure your program to meet the minimum recommendations, and what types of exercises should you include? Now let's begin with the major muscle groups. If you asked to identify them, I would list the chest, shoulders, back, glutes, leg muscles, and core muscles. The chest and shoulders can be grouped together, requiring a total of 5 different exercises targeting each group. For each exercise, aim for 2 to 3 sets, meaning that total number of sets per exercise session should range from 10 to 15, with 8 to 15 repetitions each set. At this juncture, it's important to decide where you prefer to exercise. Are you drawn to the atmosphere of a gym, enjoying the company of others, or do you find more comfort in exercising at home? If you're leaning towards home workouts, consider whether you plan to purchase any equipment or if you intend to focus purely on calisthenics, or is buying at least a resistance band an option for enhancing some exercises. Personally, I like to have both options open. So I usually go to gym once a week, but I have a longer workout, and the rest of the days I try to do exercising at home. Yes, exercising at home can be a little bit boring, but the home workouts offers me convenience and also helps me to be consistent with it as well. Having children, it's easier to make sure that I'm consistent in home workouts, and there are some days where I'll take care of my kids as I continue to do my home workouts. So let's start by discussing the gym routine, which includes both free weights and machines. So usually I'll tell people to pick the exercises that simulate your daily activities. And it's as if you're an absolute beginner, you can start with machines and then slowly you can transition towards the free weights. So let's divide into a 2-day split. So for chest, one day you could do dumbbell bench press, and another day you can try the incline dumbbell bench press. If you prefer machines, opt for a push exercise that is flat on one day and potentially a shoulder press version on another day. For the back, choose exercises targeting the upper back and lats. For instance, one day you can do the dumbbell rows, it works really well. For a machine alternative, one could opt for a seated cable row machine. On the other day, consider pull-ups. Or if you want a machine version, you can try lat pull-downs. For legs, you might choose a goblet squat for one day. If using a machine, the leg press is a good option. On another day, one can consider lunges, or if you're using a machine exercise, exercise like leg extension can be beneficial. For glutes or the posterior chain, one option is to do deadlifts on one day, or you can consider the cable pull-through if you prefer a machine. Another day, you could do dumbbell Romanian deadlift, or for machine option, one can consider the leg curl machine. For core, one can do plank on one day, and then on another day, one can do side plank. You might start with a modified 30-second plank, focusing on maintaining the position, and then you progress with the regular plank and also increase the duration of the exercise as well. In terms of repetitions and sets, aim for 2 to 3 sets of exercise, starting with a weight that you can safely manage for 8 repetitions. As you build strength, aim to increase the number of repetitions to 15. Once you can comfortably perform 15 repetitions, increase the weight and start again at 8 repetitions, gradually working your way back to 15. This cycle of progression is something that you should continue for the rest of your life to maintain and build strength. So when it comes to home training, all the exercise that we talked about for the gym routine can also fit well for the home routine as well. But the problem is that you have to have a number of dumbbell weights in order for that to happen. So that's why it's important to make sure that we take a slightly different approach when it comes to home workouts. For chest and shoulders, push-ups are the best exercise. Your goal is to perform as many repetitions as possible. You can start with wall push-ups, then you can progress onto table push-ups, and then you can finally graduate to floor push-ups. On alternate days, you may either stick with the same routine, or if you're already comfortable with floor push-ups, you can consider trying incline push-ups. Exercising the back is a bit trickier. You can perform corner presses, or you can do Australian pull-ups, also known as body rows, on one day. If you're able to purchase a resistance band, you can also include a rowing exercise as well. On the following day, you can either repeat the same routine, or if you feel ready, you can attempt pull-ups. With the resistance band, you can also perform lat pull-downs in a doorway. For legs and glutes, you might do squats on one day, and then you can do lunges on another day. For the glutes specifically, you can perform glute bridge on one day, and then single leg deadlifts on another day. For the core, you can maintain a routine of planks on one day, and then you can do a routine of side planks on another day. If you prefer to eliminate the guesswork and follow a 10-minute home strength training routine utilizing these concepts without the need for any equipment, I recommend checking out this video. It is designed specifically for absolute beginners, where it begins at level 1 and then gradually progresses on to level 2 and level 3. Reaching level 3 may take anywhere between 12 to 20 weeks. I hope this video was helpful. If you have any questions or comments, please post in the comment box below. If you really found this video helpful, please make sure to hit the like button so this video can reach more people. And please share this video with others so that others can be benefited as well. So here is the home strength training program that we talked about, and this is the playlist where you start with level 1 and we'll go on to level 2. Okay, now I'll see you in my next video. Until then, goodbye.